As we first showed you last night, the new patient care center at Royal Jubilee Hospital is almost complete. Patients will be moving in March. Staff will begin training in just a few weeks. The state-of-the-art medical facility is not only designed to ensure the healthcare needs of our region are met, but to attract and retain expert medical professionals from around the world. A News reporter Astrid Brownschmidt shows us how in part 2 of our behind-the-scenes tour.
In the new year, medical staff will begin training in the new patient care center at the Royal Jubilee Hospital. There's a lot to learn: new systems, new layouts, new technology. But the skills learned on any one floor will transfer throughout the building. That's because equipment and storage areas have been standardized, freeing up more time for bedside care.
The clean supply rooms, the med rooms, the bedroom layouts, they're all identical. The hand washing stations, there's probably 600 or 700 in the building, they're all identical. Once you use one, you won't have to think very much to use the next one, so you can then spend your time thinking about things that make a difference.
Walk down any hallway and you can see how the layout improves the flow of the hospital.
Normal hospitals are a long corridor with a series of services along the corridor and patients on both sides. We have more of an oval or a round arrangement where the patients are on the outside and all the services are in between. So staff will be crossing corridors, not going up and down corridors. We think that'll save the average nurse on a 12-hour shift the equivalent of walking 3, 4, 5, maybe even 6 kilometers a day.
Hands-free communication devices complement the easy flow and keep nurses connected to patients.
This is a little Vocera and it works similar to a walkie-talkie but has a lot more features to it. So if the patient rings the call bell on their bed, there's a little voice that pops up and says room, whatever the room is in, is calling for your assistance. And I can hit the button here or say answer and talk to my patient through the speakers that you can see in the bed there.
The new smart beds will play a vital role in patient care. With the touch of a button, a patient can communicate with a nurse or adjust the blinds in the room. And for nurses, the features make caring for a person of any age easier.
There's a different mattress here than it is here. And the point of that is it helps alleviate some of the pressure on their heels and helps prevent heel breakdown. Other things the bed can do is it has different options such as the chair position. So if I have a geriatric patient that can't get up to eat during mealtime and that kind of thing, I can actually put the bed into a chair position and prevent them from aspirating.
Technology plays a major role in day-to-day patient care and emergency response.
If I respond to a room and my patient's having an emergency situation and I need to initiate a code blue or somebody stopped breathing or their heart has stopped, I just push the button there. And this actually causes an entire chain reaction all the way through back into the diagnostic and treatment center, which is where the emergency response people come from.
That chain reaction is a series of blue lights showing emergency responders where to go and the quickest route. It will take a few months to train staff in all the systems before patients begin moving in March 12th. Part of that training is improved infection control and a refresher course on hand washing.
We have to really focus on hand hygiene, especially in this hospital, because it was specifically designed with infection control and hand hygiene in mind.
Black light shows how dirty hands can be before they're properly washed.
How do you properly wash your hands?
All right, so basically you want to take 20 to 30 seconds. You want to rub your hands together, get the inside and outside. The main thing that people forget, I find, is their thumbs.
Infection control is the name of the game, and systems that can free nursing staff for patient care activities make this new patient care center an attractive workplace for new grads and expert medical professionals. In Victoria, Astrid Brownschmidt, A News.